Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the YouTube channel today. Today I'm doing a product-specific video about a medication called Adderall. And as I know from watching the analytics on YouTube, most people watch these videos for some people watch them all the way through, but a lot of people watch just the first minute. So what you need to know about Adderall, it is a norepinephrine booster. So if you have a condition that is caused by low norepinephrine, that's norepinephrine, abbreviated capital N, capital E. If you've got low norepinephrine, if your norepinephrine is here when it should be here, Adderall is a medication that increases norepinephrine activity. That's why I call it a norepinephrine booster. And we believe that's why it works. So for conditions specifically like ADD and ADHD and other things that might be related to low norepinephrine, Adderall is a medicine that treats that. Now in contrast, so if that's all you remember, that's good. That's norepinephrine booster, Adderall. That's what you remember. You pass the quiz. So beyond that, we talk about a lot of stuff. In contrast to Wellbutrin, which I did a video on that a little while ago, Wellbutrin is a norepinephrine booster, but it doesn't work the same way as Adderall. Wellbutrin, we believe, causes increased amount of norepinephrine activity over time by virtue of changing the nerve cell. I call Adderall a release agent because what we believe it does, that it causes norepinephrine to be released from the nerve cell. So if this is the body of the nerve cell down here, and this is the part that spits out and communicates to other nerve cells, then Adderall doesn't really change what happens here in the nerve cell itself, but when you take it, it increases the release of norepinephrine into the parts that communicate between nerve cells called neurons. So that communication, that spitting out of norepinephrine is what Adderall does. And we believe that's why it works. Now, do we actually know the true mechanism of action? We don't, but that's our belief. Why is Adderall special? Well, in some ways, Adderall is really unique because, as far as I know, it was really one of the first long-acting medications that cause norepinephrine release. So even though there's a difference now, people talk about the difference between IR, immediate release, and XR, the capsules. The original Adderall, which I've been using back basically since the mid-90s, was an ingenious product, and here's what they did. They took various forms of amphetamine and dextroamphetamine. In fact, I printed them here. I never remember the names. But they took 4 different powders. One from amphetamine aspartate monohydrate, one amphetamine sulfate, one dextroamphetamine saccharate, and dextroamphetamine sulfate. And they took 25% of 100% of this product. They basically took one amount of the first one, the same amount of the second one, the same amount of the third one, the same amount of the fourth one, and they took these powders and mixed them up. That was their technology to get a long-acting tablet. Here's how it works. Once they mix that up and make it into a tablet, which they called Adderall, the different types of amphetamine and dextroamphetamine get into your system quicker and some slower. So the first one, and I'll say I don't remember which one is the fastest, and the numbers and the times don't really matter. But if you think about a graph of time versus release, the first one gets into the system really quickly and then gets out quickly. The second one gets in a little slower and gets out a little slower. The third one gets in slower even still and out slower even still. And the last one gets in as the slowest and gets out the last. So basically what you do is you got 4 different medications that are getting in at different rates, 1, 2, 3, 4. But if you think about those peaks, once it gets in, that active ingredient, that amphetamine, that release agent that causes the release of the norepinephrine sort of stays steady over time. So without having a gel capsule or without having some type of caplets or beads or pellets that release the stuff, Adderall, the original Adderall, simply got through with the technology of mixing 4 different types of medicine to get into your system. Whereas if you just take the straight dexedrine, the dextroamphetamine, if you have that same graph of time and release, it just gets in and out really quickly. So since they were trying to provide a long-acting, that's what they came up with. It's an ingenious idea. They then went on to, I think, put a gel capsule around that to maybe extend the patent life. I'm not really sure. But later on, they came up with the actual, what they call the spancel, which has beads inside a caplet. But the active ingredient of dextroamphetamine is actually the same. So it's interesting to me that some people do really, really well on Adderall tablets and don't like the capsules. Other people do really, really well on the capsules, don't like the tablet. To me, it doesn't really matter. To me, what really matters is what works for you. But today there are two available, and it is, if you can get them, then you can have a choice between either the tablet, the XR tablet, the IR tablet, or the Spancil. And you can ask your pharmacist or the doctor that's treating all about this. But the bottom line is you just got to decide which one works the best for you. Some people have headaches with one type and don't have other headaches with the other type. It really depends on your individual physiology, but they should be available, both of you. And I say should because the next topic is to talk about what is controversial about Adderall and why is it a hard time getting it? Well, Adderall is a medication. If you've ever seen television shows like Breaking Bad or other drug abuse type shows or movies, Adderall is a medicine that can be abused. So the people that should not be taking Adderall are the ones that cause the problem. And I've done other videos on this, but just to review, if your norepinephrine is here and you take Adderall and that gets you to here, well, then you feel normal. If your Adderall is normal and you take it, you feel hypernormal. You feel stimulated. By the way, that's why in the category, Adderall is called a stimulant. It doesn't stimulate the person that needs it. It makes the people that need it, just takes them from abnormally low to normal, so they feel normal. But when they were first testing the medication, they found that, a lot of the people that took it, well, they got overstimulated. Well, that was because their norepinephrine wasn't low. The norepinephrine was normal. So yes, people that take Adderall, when the norepinephrine is normal, well, they get hypernormal, and that causes problems. Some people like that feeling of being accelerated, being energized, not having to sleep. And when they take it and they shouldn't be taking it, well, that's called drug abuse. So those people should not be taking it. Because the medicine is controlled and does have potential for abuse, there are certain rules that exist around it. And the rules should be if you don't need it, you should not be taking it. And the doctor that's prescribing it should only give it to people who need it. Those should be the rules. Well, unfortunately, what also has happened is that the agencies that control the medicines, specifically the FDA and the DEA, put limits on the production of Adderall. So, to my understanding, the Food and Drug Administration makes a guess how much Adderall should be used in the country, and then the DEA puts some type of formal limit on how much can be produced in the country. And there may be doctors involved, but I don't really care. What I know is that they're doing this, they're limiting the production of Adderall because they don't want people to abuse it. Well, in my world, trying to take care of people, the people that I want them to have it, when they're told they can't get it because there are limits, because there's, the pharmacies have run out for their annual quota, that there's only however many 1,000 pounds of Adderall made for the entire country, and that's already been used up. And so we've had years, starting back in the the first time I remember it was 2018, and then in 2019, where people literally could not get that Adderall because the pharmacies didn't have it. And the reason that we were told they didn't have it was because there were federal limits on how much could be produced. Now, there's also probably wholesalers who parse the medicine out and only give them a certain amount to certain pharmacies. And I have no doubt that that's a problem with wholesalers selling to retailers, and retailers not, retail pharmacy like Walgreens or CVS or Publix or whoever not being able to get enough. But I think fundamentally one of the big problems is who decided how much is too much? Do they take blood pressure medicine and say, we're only going to make this amount of blood pressure medicine because we don't want to have people get too much? Do they limit the amount of insulin that's made for patients with diabetes because they don't want people to have too much insulin? The idea that the government can set limits on how much should be made without really having hard knowledge of how many people are taking it, I think it's really impossible. I don't believe anybody can guess accurately. Now, the people in charge, the people that are in power, they might think that this is a good idea. From my standpoint, as a doctor simply trying to help people, when I get patients in the later months of the year, and it's October, November, December, and they literally can't get their Adderall because the pharmacies can't get it because there was an artificial limit made on production, well, I think that's messed up, and I don't agree with it. Truthfully, COVID happened, and there were supply chain issues apparently, but fundamentally, I think if they're guessing how much Adderall is consumed in America, they're probably not making that accurate a guess. And my issue is that if I've got even a new patient who was not one of those estimated people who need it, well, if they need it, well, why can't they get it? Because the government guessed wrong? I'm not really a fan of that approach. I see what they're trying to do, but fundamentally, the people that are causing the abuse problem are not the patients that need it. The people that are causing abuse and misuse problem are the people that should not be taking it. So that's my opinion on that. The dosage, it's amazing to me that some people, the big, huge guys that might weigh 300 pounds, respond to 5 milligrams of Adderall or 10 milligrams of Adderall, and other people that are small might need 30 or 60 milligrams of Adderall daily. So the dosage range is basically ranges from 5 all the way up to 60. You have to work with your doctor about how much you need. The typical side effect profile is if you're taking too much or if you don't really need it, you might feel like you've had too much coffee, amped up, accelerated, hyper, sometimes a headache, sometimes rise in blood pressure or pulse. So those are all signs that either you don't really need the medicine, in other words, you're taking it and you don't really have a norepinephrine shortage, or norepinephrine's not here, it's actually here. So that's a possibility, or simply that it's the wrong medicine for you. But the dosage range, typically those are the sort of the guidelines, anywhere between 5 per day all the way up to 30 milligrams twice a day is sort of the guardrail. I think the average dose in my practice is typically 20 milligrams twice a day for adults. That's a pretty common dose. And even though the capsule, the XR capsule, is listed as 24-hour use, the truth is it wears off like the other two. So it's very common to use the capsule twice a day as well. That's about all I have to say about Adderall. It's an excellent medicine for the people that have the problem, low norepinephrine. I think it's misunderstood and people that take Adderall are often sort of viewed as people that are taking speed or shouldn't be taking it. That's like legalized speed. I talked about that in other videos, but it's an excellent choice and excellent medicine for people who need it, not just for attention deficit disorder. A lot of people take it for this excessive daytime sleepiness, being tired during the day. Sometimes it's used by sleep doctors for that, but it's essentially, again, if anytime you feel like you need to raise norepinephrine, Adderall is a decent choice, something that could be tried easily, and when it works, it should be continued. So that's all I have to say about Adderall today, and thanks for joining me on the video on the YouTube channel. Hope it's helpful to you. I'm Dr. Dave Psychiatry. Thanks for coming to see me.